Hi, I'm Carol Majewski, the Associate Chief Quality Officer for Patient Experience at Dartmouth-Hitchcock, and your moderator for today's presentation. I'm glad you've joined us for our third webinar in our four-part COVID-19 recovery series called We're Here For You, We're Open, We're Safe, and We're Clean. As a leader for patient experience, I've heard many patients and community members share their concerns, their worries, and their questions about the safety of coming to any DH site for care right now. So we put this series together to respond to some of what we've heard. So after listening, you can feel safe to come in for your scheduled appointments or for emergency care while COVID-19 is still part of our everyday lives. We have a great panel today that will share some behind-the-scenes perspectives on our efforts to keep everyone safe. Importantly, during this webinar, you'll notice that I and our panelists are not wearing masks. That's because each of us are alone in a private office space with closed doors, so masks are not required. If you have questions for our panelists, please send us a note at social@hitchcock.org. If we have time, we'll try to answer during the program, and if not, we'll post the answers to your questions on our website, go.dh.org/recovery. Now to our panelists. Today we have Tim Bishop, who's the Director of Engineering Services in the Dartmouth-Hitchcock Southern Region, Zac Conaway, our Environmental Services Manager at DHMC, and Rich Cassano, the Director of Supply Chain Operations at DH. So thank you all for joining us today.
Thanks for having us.
Great. So I'm going to kick this conversation off with Rich. So Rich, PPE shortages were a real crisis at the beginning of this pandemic, and they were reported all over the news, social media, et cetera. There were images of healthcare workers without appropriate PPE. We saw pictures of nurses and doctors wearing garbage bags over their scrubs and snorkel masks for their eyes. It was actually scary. Could you share with our viewers what PPE really is, what we've been doing at DH since the virus began, and what we continue to do about PPE supply so we know that our patients and staff are safe?
Absolutely, thanks, Carol. So PPE is personal protective equipment. It is things like a face shield, goggles or safety glasses, face shield. It can be medical grade masks.
I'm modeling, thank you.
N95 respirators.
Got one of those too.
Excellent. It could be, it's also gloves and isolation gowns.
And here's a stylish gown.
There it is.
Excellent. And gloves.
So what our supply chain has been doing is we've been doing a lot of forward buying and analytics. So we've been partnering with our primary distributors, and we've been looking at securing all of our allocated products in the beginning of the month so that those numbers don't change on us. So the faster we get that product, the faster we can ensure that we have it for us. We've been partnering with systems like UVM up north, our neighbor to the north, and we've been able to buy more product in a bulk quantity so we can secure that product, and we split it with each other so that we have the capability to get that product first. We've expanded our warehousing capabilities. We've actually almost doubled our warehousing capabilities as of it is today, and that allows us to store that PPE product, as well as all the other products that we need to keep the doors open and all of our patients and visitors safe. So they are things like our surgical supplies and our Jansan products for Zac's team to make sure that everything is clean and safe. We support our system members with storage space there too. So Valley Regional, Mount Scottney, Cheshire Medical, New London Hospital, and the CGPs, we support them as well, and other NIA members as well. We are heavily involved in technology and the use of our people. So we're leveraging technology and people. So one of the technologies that we have is called Resolink. And what that does is that is a company that pings all over the world any kind of disruption in service or support. It can be the product, the finished good that we're buying, like a mask, or it can be the raw material that it makes up the mask. And so as soon as we get that kind of notification, our team is able to go and scour the globe and all of our all of our companies that we buy from and secure more product faster. That's a lot of what we've been doing.
Wow, that's impressive. Rich, I also happen to know that we were reached out to from New York State, from some hospitals in New York when they were in crisis. And because we were able to assess our inventory and know that we had a sufficient supply, we were able to share our inventory with other hospitals who were in crisis at the time. And you and your team did an awesome job with that.
Thank you.
So one, I'd like to say, who would have ever believed that PPE would be an everyday term now? And I have to say, for years, I've had trick-or-treaters come to my door on Halloween dressed in PPE, and I always thought that one of their parents must work at a hospital. So I have to say, one, this year I hope we get to have Halloween, and I also hope I don't see PPE as a costume. So Rich, I've got another question for you. Could you share the work that you and your team did with members of the business community and the public who've been an important part of ensuring that we had enough PPE?
Yeah, absolutely. So locally here, we have a lot of manufacturers like Fuji Hypertherm. They have the ability to do 3D printing. And so they reached out to us right away, and we partnered with them. And they started making us face shields that we need to keep our workers safe. We even had a local Boy Scout troop actually manufacture some face shields for us to help us to keep everybody safe. We have groups all over our region or in our communities that are sewing cloth masks, and they're donating to our organizations. And so with that, when they come in for their visits, we're able to give them a cloth mask so that they can take home and reuse. So these are all just great things and that are supporting our team.
I want to take a minute here to say that we can't thank the public enough for their support. At a time when so many people felt like they wanted to help in some way, donating or creating PPE was one of the only ways to do it. So Zac, I have a few questions that I know you can help answer. Our environmental services staff are frontline workers who are critically important to patients feeling safe and confident when they come in for their appointments. What are you and your team doing to train your staff on how to make sure our facilities are the cleanest they can, and how do they learn best practices to control the spread of COVID and other viruses?
Well, thanks, Carol. I think we've done a lot of things. We've had many training initiatives that we've put in place. Some specifically for COVID-19 response, but a lot of things are part of our normal training process with our staff that we've been doing for several years. We're always continually training our teams on the most up-to-date training out there, especially around infection prevention principles. We do a lot of just-in-time training as well, especially based on some of these changes that come rapidly with the pandemic for COVID-19. Additionally, we actually established in 2017 and implemented a training certification program with our environmental services technicians. That program really helped us to create experts in the field of environmental services. That's a nationally certified program that comes to us from the Association for the Hospital Environment, which is a part of the American Hospital Association. And again, that program is focused on infection prevention principles, specifically around the spread of harmful pathogens like COVID-19.
Wow, so we have some nationally certified EVS technicians working within our walls.
Yes, absolutely, and we're happy to continue to give that training to all of our new staff as they come on board.
That's great. So Zac, I'm someone who's on site most days, and I see your teams out and about cleaning in our hallways, our waiting rooms, just about everywhere. Can you share with us what steps your team has taken at DH and also at our other facilities to ensure that the patient experience will be a good one when they come in for their appointments?
Yeah, we in environmental services have a mission to provide a clean and safe environment for all of our patients and visitors. And with COVID-19, that means that we've increased a lot of our cleaning levels to include disinfection of public areas, restrooms, and waiting areas to make sure that those places are safe for our visitors and patients when they come. We also have increased the disinfection for high-touch items like waiting room furniture, elevator buttons, doorknobs, and stair railings, so that all of the surfaces that any of our patients come in contact with in public areas are clean and disinfected when they get there.
Great, thank you. It's nice to see your team. I always knew they were working behind the scenes to keep us clean, but it's also nice to see them kind of front and center. And I know they've been thanked by many members of our community and the public when they're in our facility.
And they
Before
really
I move on to Tim,
connecting.
please remember that if you have questions, send them to social@hitchcock.org. So I'm going to switch to Tim. Tim, we've learned a lot about COVID since the virus was identified in what, the last 7 to 8 months, and the word was not even in my vocabulary last Christmas. From a facilities and engineering perspective, what have we learned and how has our understanding evolved? And importantly, what are we doing to keep our patients, their families, and our staff safe?
Thanks, Carol. We learned that our group plays a critical role to ensure our clinicians and patients are safe. We're responsible for keeping the air clean, ensuring a percentage of air into our facilities from the outside. In some cases, for example, in our respiratory clinics, we did not recirculate air within those areas. Alternatively, we used 100% outside air and exhausted it back out of our buildings. We monitor our ventilation systems closely and ensure that the air is properly filtered, pre- and/or final filtration at all of our clinics. We ensure that that there is no leaks that allow air to bypass around the filters. We also ensure that the air is passing through the filters, which is very important. Our group is responsible for calculating air changes in the spaces to ensure those spaces are clear and safe before allowing environmental services staff that Zac spoke of to clean, disinfect, and finally reopen the room for patient care. Differential pressure also play a key role in our buildings. For example, we have areas that are kept at negative pressure, dirty air, quote-unquote dirty air, entering clean environments that are otherwise kept at positive pressure. These are very important environmental controls that the average person cannot see, but is in place to keep all staff and patients safe from the transfer of airborne and droplet infections. Carol, we in healthcare facilities engineering has always kept a good eye on our ventilation systems, but since the onset of COVID, there's been an added need for us to adjust environments to meet the requirements of the patients that we serve.
Wow. I mean, I can't imagine that the average patient sitting in a clinic is thinking about which way the air might be moving, and yet how important it is in terms of our ability to keep them safe.
Right, right.
So
Well, unfortunately, you have to put an eye on.
I'm glad you're here.
Right.
I've got another question that we've been asked. We all know that it's possible we may see an uptick in COVID again, and hopefully not like what is happening in other areas of our country right now, but an uptick of some kind may be possible. And how are we preparing for that as a system?
Sure. That's a good question, Carol. I remember clearly that on March 2nd, we stood up our Emergency Operations Center that remains activated today. The last week of March, we set up triage tents at 3 of our main clinics located at Concord, Manchester, and Nashua. This was in preparation for our expected surge to occur sometime in April. We saw that the tide rise in mid-April, but fortunately we did not have to utilize the tents. After we confirmed that our tide of cases was lowering, we decided that it was safe to demobilize the tents and only keep those that exist today for testing purposes. The reason I tell you this story is that we have the ability to expand and contract our responses as needed. Currently, we are preparing to replace the testing tents with office containers that will allow us to continue testing throughout the winter months. We are assessing our ventilation systems for added filtration and the use of newer technologies that are coming onto the market today. We're also evaluating our space to maintain physical distancing and encouraging remote work where possible. This pandemic can be a moving target, however, we've been successful with adjusting and being flexible to remain in front of it. I feel we at Dartmouth-Hitchcock are resilient and prepared to continue to roll with the punches.
Wow. Thank you for sharing that. Like I say, I certainly hope that we don't experience an uptick. I'd like to think that you're doing this work. I don't want to say to no avail, but I'd like to just think it's good practice, but we don't have to use it. But really nice to know that we have it in play. So in each of these webinars, I've been asking the panelists to share or reiterate an important point from your perspective that would be helpful to people who are concerned about their safety as they visit our hospitals and clinics. So, Rich, what would that point be?
For my team, for supply chain team, we really just want to let you know that this is our community too. Friends, family, and our loved ones all come here and go to all the Dartmouth-Hitchcock Health locations, and so we're here for them. We have millions of masks. We have hundreds of thousands of gowns and gloves and all the PPE that keeps us safe and you all safe. So know that we're here for you. Know that we have the products to keep everybody safe. And we are at over capacity for such things like surgical volumes right now. We're actually over budget, and we're here. We're open, and we are here for you. Thanks.
Thanks, Rich. Zach.
So as Rich said, our staff recognizes that we're a part of that they're part of this community, and that they're here to help provide the safest and cleanest facility that they can possibly give to their neighbors and their families. You know, we're here to make sure that everybody's safe when they come in for their visits and stays safe throughout their visit.
Okay, and Tim?
I was a patient myself recently recovering from a broken ankle. So from the parking lot, but from the parking lot to the exam room, at no point in time did I feel at risk. All patients and staff are screened before entering the building. There is signage on the floor to guide with physical distancing, and everyone is masked, and those in direct patient care are also wearing face shields. It's also comforting to know firsthand we have professionals at every level throughout Dartmouth-Hitchcock. We take our roles very seriously in keeping ourselves, our coworkers, and more importantly, our patients safe.
Well, I'm sorry you had to experience it personally, and I hope you're feeling better soon.
I'm feeling much better, thank you.
All right. So I want to thank the panel. You've been wonderful. I also want to thank our viewers for your questions. And again, I want to especially thank our community for your incredible support during this crisis. For the businesses, people, and families who donated and made PPE and other supplies, on behalf of the entire Dartmouth-Hitchcock system, we are immensely grateful. We also had donations of food, we had funds to purchase PPE and supplies, and then there were the incredibly heartwarming signs and drive-bys of support, all of which were so appreciated. You've been there for us, which really underlies our goal to always be here for you. If we didn't answer your question, please check back at go@dh/recovery, as we will post answers as soon as we can. And don't forget to join us next Wednesday for our final session of We Are Here For You. We're open, clean, and safe. We're going to be joined by administrative leaders of our system members at Alice Peck Day Hospital, Cheshire Medical Center, and New London Hospital, who will offer their insights on the work at their facilities to keep you safe. Have a great day.
Thank you.
Bye.
Bye.